Welcome back to the Elderly Health Physician, where we bring you the wisdom of Korean medicine combined with the best of modern science to help you thrive after 60. Today's episode is one I have been wanting to make for a long time, because it is about something that almost every doctor tells you is healthy, something that your body craves, something that you spend nearly a third of your life doing. And yet, the way most people over 60 are doing it is quietly, invisibly, building toward one of the most devastating health events a human being can experience: a stroke. Joining me again is Korea's oldest practicing physician, Dr. Henry Lee. He has spent over 40 years treating seniors and studying the ancient principles of Korean medicine that have kept generations living strong. Doctor, we are ready. The floor is yours.
Thank you, John. And I want to say this directly at the very beginning, because I feel strongly about it. Most people think they already know what bad sleep looks like. They think it means staying up too late or staring at their phone. And yes, those things matter. But the 5 habits we are going to talk about today are not those things. These are habits that look completely harmless. They look like wisdom. Some of them look like self-care. That is exactly what makes them dangerous. So, let us begin. The first habit is one I have not seen discussed in any mainstream health content, and it concerns something you probably have not thought twice about in decades: your pillow. Most people assume that pillow choice is a matter of comfort and neck support, nothing more. But researchers at the National Cerebral and Cardiovascular Center in Japan spent years studying a pattern they kept seeing in a specific type of stroke patient. These were patients who suffered what is called spontaneous vertebral artery dissection. This is when the inner lining of the vertebral artery, the artery that runs along the back of the neck and supplies the brainstem and the back of the brain, tears apart from the inside without any obvious trauma. When it tears, a clot forms. That clot travels into the brain. And in many of these patients, there was no known cause. No injury, no known connective tissue disorder, nothing. Until the researchers started asking them one seemingly unusual question. What kind of pillow do you sleep on, and how high does it sit under your neck? The pattern was consistent enough that the researchers published their findings and called the condition the Shogun pillow syndrome. Patients with high pillows sitting above 12 centimeters in height, showed a significantly elevated rate of spontaneous vertebral artery dissection. The proposed mechanism is this: when a pillow lifts the neck too far forward during sleep and the sleeper moves restlessly through the night, as all people do, the neck rotates while in that flexed position. That rotation, repeated over hours across years, creates cumulative mechanical stress on the vertebral artery at its most vulnerable segment. The researchers described what appeared to be a dose-dependent effect. The higher the pillow, the greater the apparent risk. I want to add one more layer to this first habit, because it connects directly to the pillow problem. Sleeping on the back, the supine position, is when pillow-related neck flexion does its most mechanical work. And supine sleep in adults over 60 dramatically worsens obstructive sleep apnea in a way that side sleeping does not. When you lie on your back, gravity pulls the tongue and soft tissue toward the back of the throat. The airway narrows, breathing becomes interrupted, and obstructive sleep apnea on its own is associated in the research literature with a 2 to 3-fold increase in stroke risk through mechanisms involving repeated oxygen drops, systemic inflammation, and blood pressure spikes throughout the night. Multiple sleep studies have confirmed that stroke patients spend a disproportionate amount of their sleep time in the supine position. So the first practical step for any senior listening today is simply to measure your pillow. Compressed under the weight of your head, it should not be lifting your neck beyond a neutral position. For most adults, that means a compressed height of no more than 10 centimeters. And if you are a back sleeper, consider a transition to side sleeping. It is one of the most impactful physical adjustments a person over 60 can make for their cerebrovascular health. I had a patient once. He was a retired high school principal, 72 years old, who came to me for a routine visit. He mentioned in passing that he woke every morning with a dull headache at the base of his skull and some neck stiffness that faded by midday. He assumed it was arthritis. He had used the same firm, high pillow for 30 years because it was the only way he could get comfortable. I sent him for imaging. We found changes in his vertebral artery that warranted careful monitoring. He switched to a lower pillow and began sleeping on his side. The morning headaches resolved within 2 weeks. The pillow he had trusted for 3 decades was quietly working against him every single night. The second habit has to do not with how many hours you sleep, but with how consistent your sleeping schedule is from one night to the next. And this distinction is critical because most health conversations about sleep focus almost entirely on duration. But duration is only one dimension of sleep health. Regularity is another, and the research of recent years suggests it may be an equally powerful predictor of stroke risk in older adults. Scientists have developed what is called the Sleep Regularity Index, a measurement of how consistent a person. Sleep and wake times are across days and weeks. A high score means you go to sleep and wake at roughly the same time every day. A low score means significant variation, some nights early, some nights late, weekends shifted by 2 or 3 hours. Research published in the journal Neurology found that irregular sleepers, even those achieving adequate total hours, showed significantly worse profiles for the biological markers most closely tied to cerebrovascular disease. The mechanism runs through blood pressure. Your cardiovascular system is governed by a 24-hour internal clock. When your sleep schedule is irregular, that clock becomes confused. And one of the most direct consequences of that confusion is the loss of what cardiologists call nocturnal blood pressure dipping. During healthy deep sleep, blood pressure should naturally fall by approximately 10% from daytime levels. This is a protective window for the arteries. The vessels rest, repair, and recover from the mechanical stress of the day. But in people with irregular sleep schedules, this dip is often absent. They are classified as non-dippers. And non-dippers have dramatically elevated rates of stroke, left ventricular hypertrophy, and cardiovascular death compared to dippers, even when their measured daytime blood pressure appears normal. This is a deeply important point. A person can see their doctor, have a blood pressure reading that looks acceptable, and still be exposing their blood vessels to full working pressure all night, every night, because their sleep schedule is erratic. Korean medicine has always understood this at a fundamental level. The concept of chronobiology, the idea that the organs have specific windows of peak activity, of rest, of repair within the 24-hour cycle, is ancient in Asian medical tradition. What modern science now confirms is that the blood vessels themselves have a circadian rhythm. They produce protective compounds in waves tied to the internal clock. Their inflammatory responses rise and fall in rhythm with the day. When that rhythm is disrupted by irregular sleep, those protective compounds fall out of sync with the times they are most needed, and the inflammatory responses peak at the wrong moments. I had a patient once. She was a retired nurse, 68 years old, who was proud of her sleep habits. 7 hours every night, she told me, never less. But her schedule was completely chaotic after 30 years of shift work. Some nights she slept from 11 to 6, other nights from 2 to 9. Her daytime blood pressure in my office was always in an acceptable range, but I ordered a 24-hour ambulatory blood pressure monitor, a device that tracks pressure continuously throughout the entire night. Her nocturnal readings never dipped. Her arteries were under full pressure all night, every night, without a single hour of rest. We worked on anchoring her schedule through evening routines and light management. Within 3 months, we began to see the nocturnal dip returning. She told me it was the most meaningful health change she had made since quitting smoking a decade earlier. The third habit is the one that surprises people most, because it is not about sleeping too little, it is about sleeping too much. One of the largest and most rigorous international studies ever conducted on sleep and stroke risk, the InterStroke study, published in the journal Neurology in 2023, followed nearly 4,500 matched participants across multiple countries and correlated their sleep behaviors with the occurrence of acute stroke. Everyone has heard that short sleep is dangerous, and the InterStroke data confirmed this. Less than 5 hours per night was associated with an odds ratio of 3.15 for stroke. That is alarming, and the warning is by now familiar. But what far fewer people know is what the same study found for long sleep. More than 9 hours per night was associated with an odds ratio of 2.67 for stroke. Nearly as dangerous as sleeping almost nothing at all. And a separate study published in the journal Neurology found something even more striking. People who had previously slept a short duration and whose sleep then increased to long duration over a 4-year period had a hazard ratio of 3.75 for stroke, more than tripling the risk. Now, I always take care to explain the nuance here. In some cases, long sleep duration in an older adult is not a cause of stroke risk. It is a symptom of underlying cerebrovascular disease already developing silently. Microbleeds, small vessel dysfunction, early cognitive changes, all of these can manifest as increased sleep need before any other symptoms are visible. The long sleep reflects the problem rather than creating it, but the biological mechanisms also point to direct pathways. Very long sleep suppresses the natural morning rise in cortisol and sympathetic nervous system activity that helps the body transition from rest to movement. This transition is important for healthy circulation. Long sleep also tends to reduce total physical activity across the day, compounding cardiovascular risk. And critically, extended time in bed does not mean more time in the most protective stages of sleep. It often means more time in light, shallow sleep stages, while the deeper restorative stages remain limited. The window that the research consistently identifies as protective for adults over 60 is between 7 and 8 hours. Consistently exceeding 9 is a signal worth discussing with your physician.
You know, doctor, conversations like this one make me think about something I came across a while back. It is called the Senior Body Reset After 60. I have to be honest, when I first found it, I was not expecting much, but it completely changed how I think about aging. It covers exactly what we talk about on this show: how to reset your body's natural rhythms after 60. Better sleep, stronger circulation, sharper memory, more energy throughout the day. And it does all of that through daily habits, not medications. No complicated routines. Just clear, practical steps backed by the same kind of medical thinking we explore in every episode. If you are someone who wants to take what you hear here and actually put it into action, this is a resource worth looking into. The link is in the description and in the pinned comment below. Now, doctor, please continue.
The fourth habit is about napping. And I want to be careful here because I am not going to tell you that all napping is harmful. Short, planned naps of 20 minutes or less in the early afternoon can be genuinely restorative for older adults. Korean medicine has long recognized the value of midday rest, but the InnerStroke data revealed a very specific and very important distinction. Unplanned napping, meaning falling asleep during the day without intending to, was associated with a statistically significant increased odds of acute stroke. And planned naps lasting more than 1 hour were associated with an odds ratio of 1.88 for stroke risk. These are not small numbers, and the mechanisms that explain them are worth understanding. The first mechanism involves what sleep scientists call sleep pressure. Throughout the day, a chemical called adenosine builds up in the brain. The longer you are awake, the more adenosine accumulates, and the stronger the drive toward deep sleep becomes. When you take a long afternoon nap, you discharge that sleep pressure prematurely. By the time evening comes, the biological drive for deep sleep is weaker. You fall asleep, but the brain spends less time in the most restorative stages. Over months and years, this erosion of deep sleep quality compounds. The second mechanism is more immediate. Waking abruptly from a nap of over 1 hour means waking from a deeper sleep stage, which triggers a rapid cardiovascular reactivation. Blood pressure surges suddenly as the sympathetic nervous system restarts. This surge, repeated daily, creates mechanical stress on blood vessel walls. The third and perhaps most important point about long napping is what it signals. In most older adults, a daily need for a nap of 60 minutes or more is the body's way of compensating for something that is not happening at night. Most commonly, it is undiagnosed sleep apnea. The nighttime sleep is so fragmented and so shallow that the body never recovers, and the long afternoon nap is the only way it can catch up. I had a patient once. She was a retired librarian, 71 years old, who napped every afternoon from 2 until nearly 4. Her husband told me she was nearly impossible to wake during that window. She assumed she simply needed more rest at her age. After comprehensive sleep testing, we found she had moderate obstructive sleep apnea that had gone completely undiagnosed. She was not getting restorative sleep at night. The long nap was her body's attempt to compensate. After appropriate treatment for the apnea, her need for the long nap disappeared entirely within 6 weeks. She called me to say it was the first time in years she had felt genuinely awake in the mornings. The fifth habit is the one I consider most important and most overlooked in this entire conversation. And to explain it, I need to tell you about a discovery that was made in 2012 by a neuroscientist named Maiken Nedergaard and her team at the University of Rochester. They found a previously unknown waste clearance system inside the brain, now called the glymphatic system. This discovery was significant enough that it fundamentally changed the way neuroscientists understand what sleep is actually for. Here's what happens inside your brain while you're sleeping. During wakefulness, the brain accumulates metabolic waste, byproducts of all the electrical activity, the thinking, the remembering, the processing. These waste products include proteins called amyloid beta and tau. Most people associate these names with Alzheimer's disease, but these proteins are also directly connected to the health of the tiny blood vessels inside the brain. During certain stages of deep sleep, specifically the stage called slow-wave sleep, or N3 sleep, something remarkable takes place. The cells of the brain slightly shrink, increasing the space between them. Cerebrospinal fluid then rushes through this expanded interstitial space in powerful rhythmic pulses, essentially flushing the toxic waste products out of the brain and into the lymphatic drainage system of the body. The research team found that this process is approximately 60% more active during sleep than during wakefulness. It is not a quiet background function. It is a high-intensity biological event, and it requires a specific sleep stage to occur. Without that sleep stage, the cleaning cycle does not run. And in older adults, this is not a minor inconvenience. It is a direct pathway towards cerebrovascular damage. When amyloid beta and tau accumulate chronically in the interstitial space around the brain's small blood vessels, they trigger inflammatory responses in the vessel walls themselves. This causes what researchers now call cerebral small vessel disease, a condition characterized by microscopic bleeds, tiny infarcts, and changes to the white matter of the brain. Research published in the journal Stroke and subsequent work from Cambridge University confirmed that measurable impairment of glymphatic function predicted dementia and cerebrovascular disease years before any clinical symptoms appeared. The glymphatic system already declines with age. Research in animal models found that glymphatic clearance can be reduced by 40 to 80% in older subjects compared to younger ones, partly because of a reduction in a critical water channel protein called aquaporin 4 at the surface of the brain's support cells. This means every senior is already working with a reduced biological margin. And there are specific sleep habits that many older adults practice every day that shrink that margin even further without any visible warning. The first is alcohol in the evening. Many seniors have a glass of wine before bed. They feel it relaxes them. They fall asleep faster. And they are correct, it does make falling asleep easier. But alcohol is a powerful suppressor of slow-wave sleep. It reduces the amount of time spent in deep, non-REM sleep, which is precisely when glymphatic activity peaks. So the person falls asleep quickly, sleeps through the night, and feels they have rested. But the deep cleaning cycle barely ran. Research published in the journal Alcoholism found that even moderate evening alcohol consumption significantly reduced slow-wave sleep duration. The cleaning crew showed up but was not allowed to work. The second is over-the-counter sleep aids based on antihistamines, the most common being diphenhydramine, the active ingredient in products such as Benadryl and many common nighttime cold and sleep preparations. These medications block the arousal system and produce sedation, but sedation is not the same as restorative sleep. They do not generate the slow brain oscillations that characterize deep sleep. They produce a biochemical heaviness that mimics rest without delivering its most critical function. Multiple studies have confirmed that antihistamine-based sleep aids suppress slow-wave sleep architecture even while producing subjective sleepiness. and research published in JAMA Internal Medicine found that chronic use of anticholinergic medications, which includes diphenhydramine, is associated with significantly elevated long-term risk of dementia and cognitive decline. The glymphatic cleaning cycle is being blocked precisely when it is needed most, and by the very medication people are taking in the belief that it is helping them sleep better. The third factor that suppresses slow-wave sleep is irregular sleep timing, which we discussed earlier. Circadian disruption specifically reduces the amplitude of slow-wave oscillations. The depth and power of those brainwaves is diminished when the body's clock is confused, which means that irregular sleep timing harms the brain through two simultaneous pathways, through blood pressure and through glymphatic failure. The solutions to this fifth habit are practical and require no prescription. The first is to protect a window before sleep that is free from alcohol. Not forever, not completely, but not within 3 to 4 hours of bedtime. This alone has been shown to meaningfully restore slow-wave sleep architecture. The second is to speak with your physician about alternatives to antihistamine-based sleep aids, because there are options that do not suppress the deep sleep stages. The third is to anchor your sleep schedule, as we have already discussed. And the fourth is one of the most effective and most underused tools in Korean medicine: cooling the body in the hour before sleep. Deep sleep is directly correlated with a drop in core body temperature. When the body cools, the brain initiates slow-wave sleep more readily and enters it more deeply. Lower your room temperature. Take a warm bath or shower, because the rapid cooling of the skin that follows a warm bath is one of the most powerful natural signals to the brain to begin deep sleep. Avoid heated blankets. Remove extra layers. Let the body temperature fall naturally. Research published in the journal Sleep confirmed that even modest reductions in ambient sleep temperature meaningfully increase slow-wave sleep duration. I had a patient once. He was a retired accountant, 66 years old, meticulous about his health. He exercised regularly. He watched his diet carefully. He had never smoked. He slept 7 hours every night, but he had a ritual of 2 small glasses of wine before bed that he had maintained for 20 years. And several nights each week, when he woke around 3 in the morning and could not fall back to sleep, he took a diphenhydramine tablet. He suffered a lacunar stroke, a small but meaningful infarct in the deep white matter of the brain that left him with mild word-finding difficulties and subtle changes in his gait. His neurologist attributed it primarily to blood pressure. His blood pressure was only slightly elevated. When we reviewed his complete sleep history and the imaging findings showing white matter changes consistent with chronic small vessel disease, the picture looked different. This was not primarily a blood pressure story. This was a glymphatic failure story built quietly over 2 decades, 1 glass of wine and 1 antihistamine tablet at a time.
Doctor, what we have covered today is going to stay with me. We started with a pillow most people have never thought twice about. Then we talked about the hidden danger of irregular sleep schedules. Even when the total hours look fine, we learned that sleeping too long carries almost the same risk as sleeping too little, and that long daily naps are often the body's signal that something has gone wrong at night. And we ended with the discovery that none of us were taught about in school, a cleaning system inside the brain that only runs during the deepest sleep, and that millions of seniors are unknowingly blocking every single night. I want to ask you one final question, doctor, and I want the answer to come from your 40 years of experience, not from a journal. If someone over 60 is listening right now and they take only one thing from this conversation, what should it be? I will give the last word to myself because I think we can all feel the weight of what was shared today. What Dr. Henry Lee has described is not a list of problems. It is a list of solvable things. The pillow can be changed tonight. The wine can be moved to earlier in the evening. The sleep schedule can be anchored starting this week. None of this requires a prescription, a hospital visit, or a difficult sacrifice. It requires only the understanding that what happens to your brain during those dark, quiet hours is not passive. Your brain is working, it is cleaning, it is protecting its own vessels. All it is asking is that you give it the right conditions to do it. Do not wait another day to make those conditions possible. The link to the Senior Body Reset After 60 is in the description and in the pinned comment below. We will see you in the next episode.